Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today we're talking with Dr. Evan Anderson of the Anna Shaw Children's Institute in Dalton. Thank you for joining us today, Dr. Anderson.
Thank you for having me.
Dr. Anderson is a child psychologist at Anna Shaw Children's Institute at 1201 Burleson Road behind Hamilton Medical Center in Dalton, Georgia. Dr. Anderson graduated from the University of Central Arkansas with a PhD in counseling, psychology, and completed his internship in pediatric child clinical psychology at the University of Texas at Austin. Dr. Anderson, how long have you been with Hamilton?
I've been working there a little over a year.
What do you like to do in your spare time, Dr. Anderson?
What's that? I love playing racket sports. I love racquetball. I love tennis. I've recently rekindled my love for reading, both fiction and nonfiction, and I love to go on walks with my family.
What? That's great. Now, why did you choose to become a child psychologist?
You know, I remember early on in my education, I was doing some rotations in adult clinics, and I just noticed that it seemed like a lot of the patients I was seeing were making progress, but very slow progress. And then I did a child rotation, and it was, I saw these kids, and they were really flexible and willing to learn, and I just started to have this passion for early intervention, and plus the kids are just so great. They're funny, and I just every day was a laugh for me. So I really developed a love for working with kids and their the fun imaginations and just things like that.
What do you think your favorite part of your job is?
These big personalities and these little bodies. These kids are just so funny, and they're so full of life, and I love working with them and playing games with them, and I feel like I'm one of the only people that gets to play with toys still into adulthood, and I just love coming to work and having fun every day.
Tell me about the Anna Shaw Children's Institute.
We opened back in spring of 2019. The institute is dedicated in the memory of Anna Sue Shaw. We serve children birth to age 11 who are experiencing challenges with developmental delays. The institute includes me, a psychologist, 2 developmental behavioral pediatricians, physical, occupational, and speech therapy. We also do feeding therapy and music therapy. And we have behavior analysts and other very dedicated staff there to help patients. So we do physical therapy, we do occupational therapy, we do speech therapy. Psychological services include individual therapy, family counseling, and just behavioral support services. We also do assessment. So we assess kids with developmental delays or cognitive delays. And we also have a treatment navigator that helps families to navigate this difficult process of receiving treatment and helping them pay for that treatment and connecting them to resources. So it's a really unique opportunity that we have here in Dalton to have all of these services under one roof, and we're happy to provide those services to the community.
Wow, that is wonderful that all this is available to families here in our community. Let's take a quick break. When we come back, we're going to talk about some of the specific services that are offered at Anna Shaw Children's Institute and some helpful strategies to help with anxiety. We'll be right back.
If you're in need of medical care, don't delay. Your health won't wait. Hamilton Medical Center is ready to care for you. We are following CDC guidelines. Patients and guests are screened for COVID-19 symptoms. Those who are suspected to have the virus are treated in a separate area. Plus, Hamilton's high-powered UV light robots eliminate 99.9% of bacteria and viruses on surfaces. Please do not delay medical care. Your health won't wait. As always, Hamilton is here for you.
So, we've learned a little about how you and the rest of the team at Anna Shaw Children's Institute helps kids and families. But can you tell me about some of the specific services that are offered?
Yeah, sure. So the psychological services that we offer are, first, what we call ABA therapy, applied behavior analysis, and this is a therapy that we do with very young kids, and up to age 11. But it's a pretty intensive form of therapy, and it helps children who are having behavioral difficulties that might be placing themselves at risk of having an accident, or maybe just their adaptive living skills are deficit. And
right.
So we have therapists that work with them sometimes multiple hours a day to help them build those skills. We also have individual therapy where children who may be struggling with anxiety or depression might be able to get services. And this is especially important since we also see children with autism, and it's often difficult for providers to provide those types of counseling services if they don't have the experience working with children who have developmental delays as well. We also provide family therapies just because we recognize that the best helpers that these children will have are their families and their parents. So we provide training for the parents to help them maximize their time and their influence on their...
Now, on the family therapies, would that be the entire family, including the children, or just the parents, or sometimes both?
Sometimes it does include the whole family, especially sibling dynamics are very important when we're talking about treatment of children with developmental delays. So more often than not, it's just the parents, and often it's just one parent just because we have work schedules and things that we need to work around. But
and there's a lot of one-parent families now.
That's right, and that's so we do what we can with what we're given to work with, and I think no matter how many people show up, we're able to do some good and to really help these kids. And part of, it's kind of fun too with this family therapy. Sometimes we have rooms with, one-way glass, and we might provide them with coaching. We might put a little radio in their ear and give them some live coaching. We have a great time with the parents.
Oh, what a great idea.
Yeah, it's a lot of fun. And I think a lot of parents are kind of sad to leave because they're having such a good time with it.
And they learn so much.
They do,
very much. They learn
so
so much, yes.
Very much so. We also have a social skills group that we're very proud of. So many kids, they in this age of technology, sometimes they don't learn all the social skills that we would like them to have. And so we have a group that meets, right now they're meeting on Tuesday nights, and I go and work with the parents, and we have some wonderful facilitators that takes the kids, and they play games together, and they do activities that are going to help them to practice these social skills that they learn. And we've seen a lot of great success from that as well. And then we also have we have psychological evaluations that we offer. So much of children's lives is school, and we want to help them to have success within school, not only because that's going to teach them the skills that they need to learn to thrive in life, but also many of the services that are available to our children can only be accessed through the school, or are more readily accessed through the school. So we do the psychological evaluations that help them to gain access to those
right.
services.
No, exactly. It's very important.
Indeed. So we also have we want to connect kids with resources. As mentioned earlier, we have a care navigator, and one of her jobs is to connect families to resources. And we have some pretty exciting connections out in the community. We connect kids to what's called hippotherapy, which is actually working with horses.
Hippotherapy?
Hippotherapy.
Hippotherapy, okay.
That's right. Which hippo apparently means horse. So it's horse therapy. So, working with that can be do a lot of good for the kids. But we like to connect them to the many abundant resources we have in the community, both from just kind of a fun standpoint, and for providing financial aid to the families, and just whatever we can do to help. We also have a great music therapist. She recognizes that music can often be a pathway to reaching children who aren't reached in any other way. And she exercises great behavioral principles and teaches the parents as she goes and teaches the kids as she goes, all while they're playing instruments and singing songs. And
Yeah, I think that is so important. I think children, a lot of children, and you know much more than I do about this, but a lot of children, music is so important to them. They spend so many hours listening to music, and if they get the opportunity to play music and to learn music, and they can learn around that, and that I'm sure would help in any kind of issues that come up in their lives.
That's right. That's absolutely, and it's a great confidence builder for them too, as they start to learn some of the patterns that they can follow along, and it's just a really wonderful avenue to have.
Good. Okay, let's talk about anxiety. Many people deal with anxiety, even children. Tell me more.
Well, all emotions serve a purpose. Anger can help us take control of a situation. Sadness can be a signal to others that we're needing help. And pursuing happiness can help us to achieve great things. So feeling anxious helps us to anticipate potential obstacles or problems that we might encounter. The problem is that sometimes we start to anticipate problems in an exaggerated way or imagine obstacles that aren't really present. So kids with their limited life experience and big imaginations are certainly not immune to this.
Wow, that's really interesting. Why do you think that anxiety is more prevalent now than in earlier times in history?
Well, that's an interesting question. I think that there's many reasons. We can start with one that I think is really fascinating. I mean, that just has to do with how our brain has grown over the many, many decades and centuries. There's a term called the Savannah Principle, which is basically stating that the last big growth in our brain was 10,000 years ago, and so we have a 10,000-year-old brain that's trying to deal with modern problems. And so an example of how that might be a problem is you think about some of the issues that might have caused us to worry back then. Might have been getting attacked by a large animal, not having enough food, or really it was about survival. And so if you have a big report due or you have a big presentation coming due, the strategies that would help you survive a bear attack aren't exactly going to help you very much in this presentation.
That's right. Yes, exactly.
So when your brain feels nervous and is trying to escape something, it might increase your heart rate. It might make your breathing more rapid. It might make your stomach kind of hurt because it stops digestion.
Well, these are all things that have happened to me. They've got to happen to other people. Yes.
Yeah, and so hopefully some people are getting some answers right now where they know that they're not they're dying or going crazy or anything. That everybody feels these things, and it's just your body trying to help you in a difficult situation, but it just doesn't quite have the updates that it needs yet. And so when we experience panic attacks, it's just our brain trying to prepare us for that fight or flight reflex that we learn about in 7th grade biology, which, as I said, it helps if we're getting attacked by a bear. It does not help us if we're trying to work on a report that's due the next day.
Right.
So, I think that a lot of times helping people to understand that is one of the biggest steps where they know that they can, that this is just a natural thing within their body and it's something that they can fix.
Let's take a quick break. When we return, we're going to talk about the different types of anxiety.
If you're in need of medical care, don't delay. Your health won't wait. Hamilton Medical Center is ready to care for you. We are following CDC guidelines. Patients and guests are screened for COVID-19 symptoms. Those who are suspected to have the virus are treated in a separate area. Plus, Hamilton's high-powered UV light robots eliminate 99.9% of bacteria and viruses on surfaces. Please do not delay medical care. Your health won't wait. As always, Hamilton is here for you.
Dr. Anderson, there are different types of anxiety, right?
Yeah, that's right. There's, I think the most common and the one that people recognize the most is generalized anxiety, which is when you're basically just worrying all day. When you tend to look at things and worry about them, and you want to kind of maybe catastrophize a little bit, assume the worst is going to happen, and you might find it difficult to calm down. And the problem with this is that as you keep worrying and as your body remains keyed up,
right,
that you start to feel very fatigued. You feel tired. Your muscles hurt. It might impact your sleep, and you become irritable. So many people who have generalized anxiety, just because their body is redlining so often, they start to feel the physical symptoms of anxiety, which we call somatization, and they begin to think that something's very wrong with their body, and that they might be dying. Is actually a very common belief when you have this anxiety and you've been living with it for a long time. And so what we find is that many people who present in the ER are often there because of anxiety, and just anxiety symptoms that have built up over time and have caused pains to develop in the body.
This would be like a panic attack?
Yes, it would be very similar to a panic attack. And oftentimes people go to the ER because of panic attacks, because panic attacks often mimic heart attack symptoms. And so, of course it's better safe than sorry, and we want people to go and check that out. But part of the treatment for anxiety is to recognize when symptoms are being brought on by anxiety and when they're being brought on by something maybe a little bit more serious.
Yeah, I got you. Okay.
And then we have social anxiety as well, and social anxiety is experienced very heavily amongst children, where they just they have an irrational fear of being in social situations. And really what that boils down to is they feel like if they go into a situation that a social situation, that they're going to be what we call negatively evaluated, that somebody's going to judge them, and that's
that peer thing.
That's that peer thing, and honestly, we've all been through high school. Maybe a little bit of social anxiety is a little bit healthy for us all, but we don't want it to get too far. And
no.
and so what goes on in the brain is that you make this assumption, well, if I go talk to that group, they're going to make fun of me, so you don't go talk to that group. And your brain says, hey, you did a great job. We avoided getting made fun of. But, the trick there is, did we actually avoid getting made fun of, or did we avoid making new friends? So part of the way we treat that is by teaching kids to go and experiment, and giving them the courage to go try it out and learn that, hey, bad things don't always happen.
Now, this happens around strangers, around friends, and even sometimes in the lunchroom. You got a place to sit, and you want to sit with your friends, or you want to sit with the new people, or you want to make new friends, and you don't want to get embarrassed or embarrass yourself.
That's right. We protect ourselves, and sometimes to our own detriment.
Absolutely. And that goes into adulthood.
It does. We carry that into adulthood with us, and it's much easier to be unsocial when we're an adult, because we can choose when and where we go places, whereas kids are often kind of pushed into social situations, and it's oftentimes a good thing. I'm not saying to always push your kids into social situations, but it's a great thing for them to learn. To
get out of their comfort zone.
Exactly.
Sometimes.
That's exactly right.
Yeah.
So we also have specific phobias, and I think specific phobias are something that people get really interested in. They often ask me, what's the name of this phobia? And I don't know. I never know. It's there's
so many of them.
There are so many of them. I can't remember all the names. The important part is that they are scared of this one thing, and sometimes it's brought on by a negative experience, and other times it's just something that they were kind of born with, and we don't really know where it came from. But it's just that there are some things in some people's minds that are really, really scary to them, and they will avoid it at all costs. And it will often disrupt their life and disrupt their success if they don't get it treated.
Well, excellent example. A lot of people love clowns. Other people are scared to death of clowns.
That's exactly right. There's a whole business built around clowns.
That's
so
right.
Apparently enough people like them, but a clown phobia is actually a very common one.
And I can't imagine why people would be afraid of a clown.
Well, they're there to make you laugh, right?
That's right. But many people are scared to death of them. And the number 13, or there's so many of them.
Mm-hmm.
There's so many of them. Snakes. Now, would snakes be one?
Absolutely.
Okay, because I'm scared of snakes.
Yeah.
But I don't really know anybody who's not.
Yeah. Well, and of course you kind of get into this gray area where like, oh, aren't you supposed to be a little bit afraid of snakes?
Right.
Like, isn't that a good, healthy fear? And really it comes down to what degree are you afraid of snakes? So there are some people that will leave the room if a snake pops up on the TV,
Oh, wow. Okay.
And so
that would be a phobia.
That would be a phobia.
Gotcha.
Yeah. So and the same thing with like heights. You have obviously having a healthy fear of heights is a healthy thing. But if you won't even, climb up 5 feet of stairs because of fear of falling,
that's an issue.
That's a different, it's a different story. So then we have some conditions that are related to anxiety, like obsessive compulsive disorder. And then up until, about 5 years ago, obsessive compulsive disorder used to be considered an anxiety disorder. But now it's kind of its own thing, and we'll leave that to the scientists to tell us why. I don't really know why they made it its own thing,
yes.
But it's still very much treated like an anxiety disorder.
Now, what is that exactly?
So obsessive compulsive disorder is made up of two components, surprisingly, obsessions and compulsions. So obsessions are thoughts that kind of rush into your head unbidden, and they stay there, and you can't get them out. No matter how hard you try, they're just thoughts that keep coming and keep coming.
You're obsessed with this.
You're obsessed with it, exactly.
Yes. Okay.
We call them intrusive thoughts. And oftentimes, to deal with these intrusive thoughts, we develop what we call compulsions, which are these little rituals that we convince ourselves will help us with these obsessions. So, as an example, if you're obsessed with this idea of your house burning down, you may develop the compulsion to check your stove 22 times before you leave, or maybe you need to take a picture of the stove knobs to make sure that they're off. And you can see why that might make you late for work, or maybe you're having to leave during lunch to go check on your stove and all of the wires in your house. And so some of these compulsions make sense to the situation, and others of them are kind of strange.
And these are things people make up in their own mind.
There are, yeah. They come from the human mind, and
but there are ways to help people.
There are. There's medications, and there's forms of like exposure therapy where you can help demonstrate to people that if they do not go through their rituals, that life will still move on, and not only will it move forward, but it will move forward successfully. And so you kind of you introduce them to these things subsequently and gradually. And so just going back to the example of the stove, if somebody needs to check their stove 22 times, you might encourage them, well, why don't you try 21 times and see what happens? And
just keep bringing that number down? Keep
bringing the number down and just demonstrating to them that this is okay if this doesn't happen. And that obviously takes time, but you build some momentum with them as you get going, as they start to trust the process a little bit. And it's honestly something that they will carry with them for the rest of their life, but you can bring those symptoms down to you can turn down the volume on those symptoms quite a bit.
Well, this is very interesting. Mm-hmm. There is so much to be learned about this, and so many lessons to be learned.
Yeah, and I'm hoping that if somebody is going through this, that they can, recognize that this is very treatable, and this is something that's kind of within the realms of normal. And
you're not the only one.
You're not the only one, exactly. And then lastly, we look at post-traumatic stress syndrome, which is when our body or we experience something traumatic. And I think a misconception about PTSD is that it has to be something that you experience directly. But this can often be something that we experience indirectly. I've had children that are traumatized by stories that they've heard.
Wow.
Just that they've related to them to such a degree that they traumatized, and it fundamentally shifted the way they thought about it. And what happens in the brain is there is a fundamental shift where your brain kind of shifts from maybe, casually exploring the world, looking for new fun things to learn, to being in a survival mode. And so oftentimes you have to monitor your environment and And trauma can really impact your body very negatively. So it's important, if you have been traumatized, to seek treatment so that your body is not so anxious all of the time, because it can really impact your health in a major way.
I never knew there were so many different kinds. What are some of the signs that a child is suffering from anxiety?
A big one is insomnia. So if they're having a difficult time going to sleep at night, and also early waking. So if they're just not sleeping very well, honestly, that's something that many of the adults listening will probably relate to as well. When we're worried about something, we can't fall asleep, and then we're up before the sun trying to deal with it. But also with kids, we want to look at skin picking, or nail biting or hair twisting, things like that. They will often develop these little fidgets or these little tics that might indicate some anxiety. Sometimes kids are very critical of themselves. We might recognize one of our own children as perfectionistic, but if it's something that they kind of are constantly belittling themselves and just talking about how they could have done better, that could also be a sign of that fear of negative evaluation.
What are some of the conditions, in addition to anxiety, that you treat at the Anna Shaw Children's Institute?
That's a good question, and it's an important one, just because when we're dealing with mental illness, the differential diagnosis is important. So a lot of times we've talked about how there's sometimes overlap in some of these symptoms, where a kid might be getting in trouble at school because of anxiety. We might assume it's ADHD or oppositional defiant behavior, but it's important to identify what is actually driving these behaviors. So things that we treat at Anna Shaw, we treat attention disorders, attention deficit disorder, of course, autism spectrum disorder. We do treat ODD, oppositional defiant disorder, or any type of behavioral issues that are occurring. We do treat anxieties. We work with kids who have general anxiety, social anxiety, selective mutism, and phobias. So we want to treat all the kids with anxiety, and even kids that may have been through something traumatic. We treat kids who have learning disabilities as well. We help to identify those children through evaluations. A lot of those evaluations can be offered through the school, but sometimes we do kind of a deeper dive into their cognitive functioning. And then we will also help kids with just basic adaptive living skills as well. We help kids with speech disorders, language disorders, physical impairment. We help them get set up with the right equipment, the right programs, and help them to develop handwriting skills and all of the needed skills that children need to succeed, both in school and outside of school.
Okay, let's talk about COVID-19 now. What would you say to someone who is putting off having their child seen at Anna Shaw Children's Institute because they're worried about the coronavirus?
Yeah, great question. I think at Hamilton Healthcare Systems, we take this very seriously, and we want to put staff and patient safety first. When patients arrive, they're greeted by a staff member who takes their temperature and screens them for COVID-19 symptoms. We're following the CDC guidelines and put many of the processes in place to help keep you and your family safe. Everyone wears face masks. We use protective equipment. Protective equipment is supplied to all team members. We use social distancing, so we often use bigger rooms than we need, so we can social distance. We sanitize after every meeting, after every visit.
Dr. Anderson, thanks for that great information. If you could leave our listeners with one word of advice about anxiety, what would it be?
That you're not alone, and that there are ways to treat it and make your life better if you're willing to put the effort into it. But don't run away from it. Resist that urge to run away from it and just meet it head on, and it'll get better.
For more information about Anna Shaw Children's Institute, call 706-226-8888. 8900 or visit hamiltonhealth.com/children. For an appointment at the Institute, please ask your child's pediatrician for a referral. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.